next sort of agenda that we have, and it's about anti-aging therapies. So, like looking young is a thing in India, I think all around the world. So,
Yeah.
what are your like what are your recommendations and
Okay,
uh,
so
medical
yeah,
knowledge?
sure. So firstly, Disha, I have a different concept about the anti-aging. In fact, I'm specialized into anti-aging medicine. You know,
Uh,
anti-aging is a very, very
oh,
beautiful science, right? And you have to understand aging process for that. So it is not, aging is not when you cross a particular age, whether it is 30, 40, 50, 60. Every day since we are born, we are aging each and every day. Okay, but when do we start taking care is very important, right? So here also prevention is better than cure is very important formula. You know, when you start taking care early in your life, when you start having good hydration, when you start having good sun protection where you can prevent the sun damages, you know, then you will prevent the early signs of aging. So early signs of aging usually starts, you know, between 25 to 35. That is the age group when the early signs of aging starts. And what is the early signs of aging? See, people just say lines and wrinkles. Your anti-aging is not limited to your lines and wrinkles. When you start seeing dehydration, uneven skin tone, freckles onto your skin, or sunspots, sun damages, you know, any of these things, or dark circle, and then it progresses, you lose the collagen and the important hyaluronic acid from the inside of the skin, then is the time when you start seeing the early lines and the wrinkles. And if you still ignore it, you start losing the tissue volume and it starts sagging, and you start seeing the jowl and the heaviness, and ultimately you see the entire aged skin, aged not only in terms of elasticity and firmness, the skin quality, but you also see a lot of sagging, volume loss, and a lot of things to be corrected, right? So this is how the natural aging is. A facial shape determines a lot about the aging process, because you know, we all have, when we are younger, we have like a inverted triangle, which is like our upper face is broader and the lower face is narrower. But as we age, this dynamics changes and it becomes a proper triangle, where our base becomes broader and our this becomes narrower. So this is how the aging concept works. So I think that aging, again, anti-aging medicine, something which you need to start early, start taking care, and then you can, there is nothing in this world which can reverse or stop aging process, because this is natural and we have to accept it. But what you can
yeah.
do is you can definitely delay it. You can definitely look best at your age, right? If someone is 30s, they need to look best in 30s. If someone is 40s, 50s, 60s, look harmonized, look fresher, look, you know, healthier. This is what sums up for me anti-aging. Anti-aging is not only wrinkles and folds. That's it.
Yeah, like that too we see generally in the like 40s or 30s people journey, and then they start thinking about aging process and stuff. Your advice is to go for early medications for anti like aging
No,
process.
Disha, it's not early medication. Always remember, we as doctors promote health. I am promoting skin health, not medication. It is about early care, early prevention, right? Early regime. These are the words I would believe rather than early medication. Medication, kya aap loge? Today, for example, even if you visit me, a person
Mm.
like, you know, a young girl like you who is very beautiful, I will just advise her, listen, you know what, I can see a little bit things here and there, little unevenness. You're so beautiful, but you need to have a lot of hydration into your skin. You know, you need to have something which is actually not your genetically, it looks like your lower face will be heavier if you do not take care, do a good exercise in routine. You cannot ignore lifestyle, right? So you know, we are just the boosted addition to your lifestyle.
Yeah,
So yeah, I don't think so medication is the word. It's about the right guidance and the right care, and of course, when needed, the right intervention in terms of either medical or non-medical. The intervention can be, you know, physical exercise as well. So intervention can be medical as well as non-medical.